All right, we'll go ahead and get started. Welcome back, everyone. So today is week 3 of our series, and we will be talking about medications, how to handle medications, important tips and tricks about medications, procedures, and then navigating the hospital. So same disclaimers as last time, same format. So let's get started. So as far as medications, I would like to start with a definition because I think different people use the word medication to mean different things. Medication is essentially any substance used for medical treatment, prevention, or diagnosis. That means it's a pretty big umbrella term, and it includes things such as supplements, vitamins, certainly prescription medications, over-the-counter medications, creams, injections, any liquid that might be used for a medical purpose, even foods can be medications. So the important thing about this is that when going to your medical provider, mentioning all these things is important because these are things that can affect the body and affect other medications that you're taking or using. So even supplements and vitamins are important to count under that umbrella term for medications. Almost everyone will eventually take medications at some point. So knowing a little bit more about them is really important. Specifically, knowing what you take, how much, and for what purpose. All those are really important when coming to see your medical provider, or really at any time. It's a good idea to keep a list of what you take, either in your wallet or your purse, or on your person, really. And yeah, keeping this list updated is important. Having a list of allergies along with that same list of medications is important if you are in a let's say in a medical emergency and the paramedics come by. It's good to have a list of those medications on hand on your person so that they know what you may be allergic to. And not only what you're allergic to, but right next to that allergy or medication that you're allergic to, saying what happened as far as a reaction goes. So reactions to medications could be anywhere between a rash to life-threatening reactions to just having some nausea. So knowing what those reactions are important because if you ever need that type of medication in the future, whether you had a severe life-threatening reaction or you had some nausea, that obviously makes a difference as to whether that medication can be used in the future. It's important to make the distinction between over-the-counter and prescription for practical purposes, but in terms of whether one is better or worse than the other, it really truly depends on the specific medication. So over-the-counter medications are not necessarily any safer or any riskier. They're not necessarily more or less effective. And also, they're not necessarily cheaper or more expensive. It kind of just depends on the specific medication. So saying that someone only takes over-the-counter medications medically doesn't tell me much. I would need to know exactly what they're on and how much of each so that we can learn more about the risks and benefits of those things. Whether something is over the counter or not is really a regulatory matter, not a medical matter. So the FDA decides what is regulated as an over-the-counter versus what has to be obtained through a prescription. And a lot of these things are kind of historical. So the FDA has a list of quote unquote acceptable ingredients that if those are already contained in an over-the-counter medication and nothing else, then they pass and they are approved as over-the-counter. But this doesn't necessarily mean that they're any safer necessarily. So, for example, ibuprofen is over-the-counter, but you can take enough ibuprofen to cause kidney failure. So in that way, it's not necessarily any safer than a prescription medication, which may or may not cause the same thing. On the flip side, there are prescription medications that are fairly benign. So again, just to emphasize the point that we have to analyze each thing individually. Having said all that, in theory, the FDA considers prescription medications to be classified as such because they can be potentially harmful if not used under medical supervision. But as I said with the ibuprofen example, that could also be harmful. So, so there are many exceptions. Another category of medications are controlled substances or controlled medications. These are much more closely regulated. They are regulated by the Drug Enforcement Agency or Administration, rather. And the reason for their being more restrictive on these is that they have more abuse potential. And the misuse of these can also lead to legal consequences. So some examples are opioids, like morphine, hydrocodone, oxycodone, and such. Marijuana is still under this list. Testosterone is under that list. Some anxiety medications like lorazepam, diazepam, and then some ADHD medications are also under this list of controlled medications. One thing to note from a practical standpoint, if you are on a controlled medication and you travel out of state, your doctor cannot legally prescribe that medication in another state if that doctor does not have license in that state. If your doctor is in Wyoming and you travel to, let's say, Colorado, and your doctor doesn't have a license in Colorado, then legally they cannot refill your prescription in Colorado. So this is important to know because if you're going to travel, you should plan ahead and like have enough to get to where you're going, or at least know if your doctor has a license in that state, because you know doctors can have licenses in more than one state. So asking that is reasonable, and you know, just so you know. I will say that this was there was an exemption during COVID, and this was not enforced during COVID. But now that that so-called emergency declaration during COVID is no longer in place, then it's back to the usual rule as far as that goes. Another thing to keep in mind is the difference between generic medication and a brand name medication. So both generics and brand name medications have the same active compound. So there are many, many examples of this as far as what you could get as a brand name versus not. A very simple example is Tylenol. Tylenol is a brand name. The generic name is acetaminophen. If you go to the store and look for Tylenol brand name, it'll be more expensive than acetaminophen generic, even though they're the same active compound. So whenever you can, unless they're, with very few exceptions, as far as how certain companies put together a pill and have other additives to the pill, with very few exceptions, you will get the same effect, whether it's generic or brand name. And generics are almost always cheaper, so that's also good to know. I will say, so some brand names, which is kind of the next point, don't have a generic out yet, meaning that medications are patented, just like any other invention, and their patents last 20 years. So that means from the moment of invention, that company who invented it has the rights to exclusively make that medication until the patent is over, which means that they can restrict generic companies from making the medication, which is why they can make more money off of it, because they sell it at a higher price because they don't allow other companies to make it. So they have one source of making it. So that means that they can wait until it's actually expired, and not until then will we have generics available. Once the patent expires, there usually is a several months lag period between when that expires and when generics are actually available, because the generic companies have to make and manufacture the medication, and they can't do it until the patent expires. So there's usually a lag, 6 months, what have you, until that's available. Just a comment here on generic names versus just brand names. So generic names are usually more descriptive and more scientific in a sense. I usually try to use generic names when I speak to people about medications for several reasons. One, I don't like endorsing any one brand. So keeping it generic is kind of a universal language of how to talk about medications. And two, eventually the brand names will go out of patent and you'll have the generics. So if you're only using the brand name and you're not familiar with the generic name, that can be a problem when it comes to getting your medications. So this brings me to the importance of knowing when you're on a medication, it's very important to know both the brand name and the generic name. Now, some medications don't really have a brand name if there have been in the common kind of vocabulary for many, many years. So cost. So certainly people are interested in knowing more about the cost and medications and that sort of thing. All of this depends highly on where you are. Depends on what country you're in, what insurance plan specifically, very specifically what your insurance plan is, what pharmacy you go to. Costs can vary from one pharmacy to another. And then also how the prescriber codes the prescription. So if the prescription is coded for, let's say, diabetes, or the prescription is coded for weight loss, those two may be vastly different coverage from the perspective of your insurance company. It can be the exact same medication, it's just how it's coded. So the reason for this is that certain medications are only approved for certain diagnoses. So if a medication is coded under a diagnosis that is not approved, then in the eyes of the insurance company, that's not justifiable cost. So that's the quote unquote rationale behind that. So looking at your prescription bottle and seeing what the indication is may be useful if you find out that your medications are not being covered. That might be a reason. It may not be a reason. Again, it's very dependent on your insurance. So some tips to reduce medication costs. So upfront, when you select your insurance plan, that has a huge factor, whether that insurance plan covers medications or not. Outside of that, comparing pharmacies is useful. So you can pick up the phone and call a pharmacy and ask, what is your out-of-pocket cost for X medication? Now, if you don't tell them your insurance information, they won't be able to tell you specifically for you, but they can tell you, especially if you're paying out of pocket anyway for something, they can tell you how much it is. I mentioned the appropriate coding on the script. Another option, if you find that your insurance doesn't cover your medication or it's still too expensive anyway, you can try to get some overseas options. There's Canada Pharmacy Online. Another one is called Silver Line Medicare. These are based in different countries, but the principle basically is that the script is sent to those pharmacies by fax or mail, and then they send you your medication by mail. Now, all of these will be completely out of pocket. Your insurance would not cover an out of the US pharmacy, but it can be much cheaper. And the reason for that is that pharmaceutical companies charge way higher prices in the US than they do outside the US, because the US doesn't have the bargaining power against pharmaceutical companies that other countries do have, because some other countries may have a national healthcare system that is able to negotiate with pharmaceutical companies, but that's not the case in the US. You can make the exception of Medicare, but even that is not as powerful as a whole country having, one system as far as bargaining power. As far as regulation, so that is a potential gamble. Canada Pharmacy Online is obviously based in Canada, and they have pretty solid regulatory rules in place. Silverline Medicare is based in India. So there may be a question there. Having said that, the truth is a lot of the medications we have in the US are already made overseas. You kind of have to weigh your choices there and decide for yourself, I guess. Other options are online coupons. So you can go to GoodRx, Cost Plus, CleverRx. Those are all coupon related options. And these only work for big pharmacies like Walmart, Walgreens, CVS. You won't be able to get those coupons at Ridley's, because again, it's a matter of how those companies negotiate with the pharmacies in order to get cheaper prices. And again, going back to using generic if you can, usually cheaper. But in all this, it's important to keep in mind that if you have a medical issue that can be addressed with lifestyle changes, well, maybe you would be able to reduce your medication amount that you need, or even not needed. Of course, this should be individualized and talked about with your own medical provider, but always keep that in mind. If you have, let's say, high blood pressure, and it's because, for an example, because your salt content in your diet is high, well, if you reduce that and you're okay with that lifestyle change, that might be worth doing in order to not need that blood pressure medication. Of course, it can be much more complex than that, but that's just a simple example. So how do we end up getting the medications that we have, as far as like how they end up in the market? Well, there is a very rigorous process that prescription medications go through, and that is a testing method that is called a double-blind randomized controlled trial. So what does that mean? Let's break it down. So double-blind means that both the researcher and the patient or participant neither of them know whether the participant is getting the medication or is getting a placebo. So that means double-blind. What that does is it reduces bias. So the researcher, since he or she doesn't know, then he or she can't influence the result of how you may respond to that medication. And the same goes for the person getting the medication. So this is useful because of the placebo effect. If someone gives you a pill that you know nothing about, but that person tells you this is gonna make you feel less pain, a certain percentage of people, no matter what the content of that pill, especially if it's just inactive, will get relief of pain. So what does that tell us? It tells us that our brains are very powerful at relieving certain symptoms. But the problem with that is that it doesn't tell us whether that medication is active on its own, or it was active because your brain told you that you're not going to feel pain with that medication. Now, of course, placebo effect can be nice, because if you don't feel pain, great, that's what you want. But in terms of being able to say that a medication is effective, you have to make sure that the medication is actually effective, so that shelling out $50 on it or whatever is actually ethical, and someone is charging you in an ethical manner to get what they're saying is how that medication is effective. So randomized, that's pretty easy. So that just means that if you have a group that is not taking the medication, the active ingredient in the medication, and a group that is, you randomize people into those groups so that people don't get to choose whether they get the medication or not. They, by random chance, are assigned. This also reduces bias. This reduces trends in, let's say, if a group of people in one group tend to be of higher weight than the other group, then that may influence how that medication works. So you don't want to have that additional influence. You want to make sure it's as random as possible. And then controlled trial just means that, well, you control what's going on in the trial and you watch carefully what's going on as the trial goes along. So these trials can take years. So that's one of the reasons why patents are 20 years long, because if our company invents a medication today, it may take years for that company to be able to test the medication, and maybe another 10 years before they're able to actually bring it to market. So in that time, the patent clock is ticking, I guess, from the perspective of the pharmaceutical company. So trials come in different phases. Phase 1 is just testing safety and dosage. So when it's a brand new medication, most of these medications have been tested in animals before they go to humans. So you have some idea of like how they work, their biochemistry, a good approximation of how they're going to work in humans. But in order to know how they work in humans, you always have to test in humans, and you can't just rely on a non-human animal model. So that's where the safety comes in, just making sure that no major effects happen in the humans, and then dosage, figuring out what dosage works. Dosages don't come out of the sky. They have to be figured out by testing. So this is that phase. Phase 2 is testing the effectiveness. So we think this medication is going to work for blood pressure reduction. Is it actually doing that? And then keeping track of the side effects within that. At any time during these phases, the medication may be found to be too harmful. So that's it. You end the trial. No, you don't go any further. Or it may be found to just not be effective. So that may also delay, and they can go back to the drawing board or what have you. Third phase is usually the final phase before approval, and that's where you compare the medication to existing treatments. So if a company comes out with something that rivals an already existing medication, they have to justify, well, why do we need your medication when there's already something that works out there, right? So they compare it, and the bare minimum is for it to work as good as the current medication out there. If it's not as good, then chances are that they're not going to develop that any further. If it's just as good, they may still develop it. And if it's better than, then they can even use that to kind of further expand the use of it. And then phase 4 is really after FDA approval. And that's mostly just what they call post-marketing surveillance, which is just after the medication has been out there and perhaps more people have been using it, they monitor just to make sure, okay, are there any patterns to are more people getting more side effects with this, or even more benefits? An example of this is the weight loss medications that have come out recently. Kind of the post-approval surveillance have been showing that there are more benefits than they initially thought there would be. But the flip side can happen too. You can have more side effects, more adverse effects than you thought initially would happen. So this phase is also important because if something is discovered to be more harmful once more people use it, then obviously something has to be done about that, or at least a notice has to be put out about that. So the next slide talks about assessing risk. And this applies not just to medications, it applies to a lot of things in life and how to assess risk, because everything we do in life has risk, no matter what. And at the end of the day, we just have to decide, is this risk worth doing? Walking out of your door in the morning has risk. Getting in your car has risk. But most of us decide that that risk is worth taking because of how we use that, whatever we're doing. So a big distinction to make is relative risk versus absolute risk. So as an example, to kind of bring this into concrete terms, is serious blood clots. So clots that perhaps form in the legs and then have the potential to travel to the lungs and cause serious illness or even death. So the baseline risk of all non-pregnant women of getting a clot that is serious is 1 in 10,000. So if I randomly pick 10,000 non-pregnant women in the population, about one of them out of those 10,000 will get a clot. And that's just kind of the general risk. Now, women taking birth control pills, if you take 10,000 women in the population who take birth control pills, about 2 of them will get a clot. And then if you take 10,000 pregnant women about 10 of them will get a clot. So what's my point with this? Well, the absolute risk is 1 in 10,000, 2 in 10,000, 10 in 10,000. That's the absolute risk. The relative risk is comparing each of those different categories. So if I compare the risk of having a birth control pill in place versus not, if you just say the relative risk, that relative risk is twice as high. Now, if you compare the absolute risk, 2 in 10,000 and 1 in 10,000, that's actually not that much of a difference. That's still much less than 1%. And in practical terms, that's not significantly different. However, if you say just, oh, taking a birth control pill increases your risk by twice as much versus not of getting a birth control pill, if you just hear that, you're probably alarmed by that statistic, which is why it's very important to look at the absolute risk and not just the relative risk. Similarly, for pregnancy, again, if you hear pregnancy makes you 5 times more likely to develop blood clot, that's completely true. That's absolutely true. However, when you look at the absolute numbers, you have to compare 10 in 10,000 versus 1 in 10,000. So this becomes relevant because if someone says, well, I don't want to take a birth control pill because it increases my risk of blood clots. That's true, but they have to take into account not only that the risk is small, but also that the risk of getting pregnant is actually higher for getting a blood clot than taking a birth control pill. And presumably you're taking a birth control pill to prevent pregnancy, or most women are. So you have to take all that into account. Relative risk alone is not enough to assess whether you should take a medication, is kind of the bottom line of that. And then a word about labs and other tests in general. So I think I mentioned this before, but whenever you get a test of any sort, it should be done with a purpose. So the doctor who's ordering the test should be able to know what he or she's going to do with that test result. And not only that, but how is it going to change your actual management? Is it going to change the medication you take? Is it going to change your decision on what procedure you do? What is it going to change? And both the doctor and the patient has to answer this question, because if you as a patient don't want to do anything with those results, then there's no reason to get the result in the first place. And that should be a conversation, which can be fluid. I mean, that can change depending on what the outcome is expected to be. Benefits and risks should be talked about. As far as, with a procedure, it's fairly obvious if they're going to cut into you and take something out. Well, obviously, there's a discussion there about risks and benefits, but it can be more subtle. So if it's a lab that you're getting that is just a blood draw, yes, there's some risk technically to a blood draw, but a classic example of this is a prostate test for a man, PSA. So the blood draw itself is pretty minimal risk, but if the PSA is high, let's say, it can lead to a lot of further testing, and it may or may not change the outcome, depending on, again, whether you want to do something with those tests. Having said that, it can be very anxiety-provoking if your test is abnormal, and in the end doesn't turn out to be something of concern, but you don't necessarily know that up front. Of course, the whole purpose of the test, most of the times, is to screen for prostate cancer. So it may be that there is prostate cancer, and that's why it may be important to get the test, but it's not a perfect test. So there's some kind of hidden risks in those tests too, that are worth considering, in the discussion about getting different tests. So, and then obviously there's cost. If your insurance covers it, you may not see that cost, and that's that. But if it's not covered, then again, a discussion of benefits and risks. Is it worth getting a test based on that? There are third-party labs you can get. So here in Sublette County, health fair labs are available, and those are completely out of pocket. Those don't go through insurance. They can be cheaper for certain labs, but they may not be cheaper. And for example, if your insurance already would cover those tests under a certain type of diagnosis, then it might cost you nothing to get those tests. And you may be paying more in that case through a third-party lab. But if your insurance doesn't cover it, then it could be cheaper. So again, hate to say this over and over again, but insurance dictates a lot of that. One thing that on the doctor side can be controlled is coding. So this is just an example of how it looks on the doctor's side. So on the top there, you have a list of diagnoses. You have high cholesterol, diabetes, tobacco use, etc. And then on the vertical column is tests that you're getting. So the doctor basically has to associate every test with a diagnosis. So am I getting that vitamin B12 because of a deficiency, or because I'm checking because you are on a medication that potentially reduces it, or do you have diabetes, etc. And this determines whether a lab is covered by insurance or not. So this is pretty critical. If the wrong box is checked, then that lab may cost more. Having said that, you can check all the boxes you want, but the insurance doesn't want to pay for it because that's their rule, then it doesn't matter. The insurance won't pay for it. That doesn't mean you can't get the lab. You can still pay for it out of pocket, but of course, that's more expensive usually. So circling back to insurance. So number one is don't expect common sense. Insurance is a profit-driven industry, and that's how they operate. And it's sad that that's how it is, but that is how it is. And the rules may be arbitrary. It may be kind of a kind of dark reason in the background that we just don't know about, and it was negotiated with a pharmaceutical company or whatever as to why that ended up being the way it is. But yeah, on the surface, it may be completely confusing. So what do you do in light of this? Well, number one is inform yourself about your particular insurance as much as you can. So find out, even before you sign up for it, what is expected to be covered, and how much out of pocket is expected, not just for medications, but also doctor's visits, procedures, being in the hospital, etc. And knowing these rules can really make a huge difference in terms of your how much you end up paying in the end. Keeping documents and receipts is quite useful. And keeping in mind that errors happen. As an example, last year, someone told me about this person was going to get an ultrasound, and she had gotten the ultrasound at a local facility here, and then went to a specialist. So, she already gotten the ultrasound, then went to a specialist, and the specialist initially didn't know that she had gotten the ultrasound here. So somehow or another, on the specialist side, it was logged that she got the ultrasound there too. So she basically got charged twice, even though she only got the ultrasound once. And it was only after persistence, hey, no, I only got this ultrasound here. There was no need to repeat the ultrasound because I already got it in my hometown. After multiple persistence, phone calls and all that, that was figured out. But if this person hadn't been on the ball and looked at her bill and kind of noticed that, oh, they charged me twice, they would have charged her twice. And that sort of thing, I would hope that in that case was a complete mistake. But in the end, she could have been charged much more. So paying attention to her bills is also important, and keeping receipts to prove that what was done was done. A nice website to look at is the Wyoming Department of Insurance. And it kind of walks you through different types of insurance, not just health insurance, but car insurance and other things. So if you're more interested in knowing about insurance, you can look that website up. So moving on to procedures, as I mentioned, procedures should be like anything else that is done to your body, should be made under full informed consent. Informed consent is kind of a tricky thing because, in order to inform someone, they have to be able to understand what is going on in the first place. So This depends on a lot of things. This depends on baseline kind of healthcare knowledge. And part of the job of the doctor who's doing the procedure is explaining in terms that the person understands. And that may be at a very high level, or it may be a very basic level, but it doesn't matter. That doctor should be able to explain it in whatever level they need to, and get questions answered that that person may have. Um, when it comes to scheduling, so there's a lot of logistics that go into scheduling. So, for example, making sure you have a phone number when you walk out of an office. If you're planning to get a procedure, making sure you walk out with a phone number to call. Nowadays, we can't always expect that we're going to get a phone call to schedule something. So it's better to walk out with a phone number. And then if you don't hear back in a day or two, then actually calling that number. I've seen over and over again how things are fall through the cracks, and the person just doesn't get the procedure done or whatever done because the person expected a phone call from someone else. So I tell people, yeah, here's a phone number. If you don't hear from them in a reasonable amount of time, just call them. And then we come back to costs. So checking with your insurance up front before you get the procedure is important if you're at all concerned about the cost. Keep in mind facility fees. So if your procedure is going to be an outpatient procedure, not in a hospital, and it's going to be in an outpatient facility, oftentimes those facilities have their own fees. So knowing what that fee is important so you don't get surprises in terms of that. And this information should be publicly available. So you should be able to ask for that. Oftentimes, some procedures require a pre-op or pre-operation visit. That means that oftentimes your primary care provider or even your cardiologist may have to do an exam saying, yes, you're medically okay to undergo a procedure. This is because, let's say if you have an orthopedic surgery, like a hip replacement or something like that, the orthopedic surgeon may not know your full picture of health. And especially if you have heart problems or diabetes or something like that, oftentimes your medications have to be altered in preparation for the surgery, or, things have to be optimized as far as your blood pressure or your sugar levels and all that. So a pre-op appointment oftentimes is needed in order to do that. And the surgeon, that may be outside of his or her scope of practice to do that. Not always, but sometimes. A kind of a neat trick that I've learned recently is having a travel kit with you when you go to a procedure. So what does that mean? Having kind of your own things that you will need right after the surgery, especially if you're staying overnight at a hospital. So this could be, like a change of clothes or even just like toiletries like that you like to keep. Certainly any sort of documents that are important, for example, a list of your medications. If you have a healthcare power of attorney, meaning like who's going to make decisions if this surgery goes wrong, having that on hand is important. So keeping that with you is good to have. And then after the surgery, it's good to keep a hold of the instructions that they give you afterwards, and certainly following those as much as possible. And keeping your follow-up appointment. Follow-up appointments, not only with that surgeon, if it's a surgeon, but sometimes with your primary care provider, you need a follow-up appointment because things may change because of the surgery. You may not need as much medication. You may need more medication. So these things are also important to follow up on. It's not just a one-time and done usually. As far as hospitalization, so this is a stressful thing to undergo, or can be anyway. So knowing where you're going is important. Now, if you are the one who's sick, you may not have the mental capacity at that time to do that. But if you're with someone, they can help you. Knowing where you're going, knowing why you're going. If you're in an emergency room and the provider there tells you, well, I recommend going to the hospital, you should know why. You should consent to that. And if that's appropriate. What I mean by that is you should have the ability to consent to that or refuse it if you don't want to go. And also knowing where you're going. So here in Wyoming, depending on your condition, you may go to Jackson, or you may go to Idaho Falls, or you may go to Salt Lake City, and it all depends on how complex things are and the weather. I've seen people who've had to actually have to delay care of a heart attack because they couldn't get out in a snowstorm. And really, you can't do anything at that point. I mean, if you can't fly out, if you can't drive out because there's a blizzard, well, that's just bad luck, unfortunately. Yeah. And places like we live here, that happens. And you have to keep that in mind. So on that note, transportation also is an important point here. This could be yourself, it could be by ambulance, it could be by helicopter, it could be by plane. Here, a lot of people have insurance that covers transportation. This can be important because a helicopter or plane flight that is a medical flight may cost $60,000. Just plainly $60,000. It could be even more. So if this is not something that's covered by your insurance, which if it's regular insurance, it probably will not be covered. This is a big deal. And ideally, if there's an emergency and there's medical reason for you to be flown out, hopefully cost is not a hindrance to that. So that's something to keep in mind in a place like where we live. Let's see, a ready to go bag is kind of what I mentioned as far as a travel kit and that sort of thing. Other things to have there are plans for people who are, let's say, taking care of your house. So let's say you have a pet and you have a hospital stay that is unexpected. What is going to happen to your pet if no one else is at home? Well, that sort of thing is kind of important to know ahead of time. If if your health is such that you could end up in the hospital, and truth be told, anyone could end up in the hospital. There could be accidents and stuff like that. So having a plan for people to say, hey, if something happens, can you take care of my pet? And then having that phone available to call them or whatever. And then, like I mentioned, advanced directives like healthcare power of attorney, code status. Code status we'll get into a lot more next time as far as what that means. But it's basically whether you want to be resuscitated or not. Now, in the hospital, there's a lot of moving parts. So typically when you first go in, there's an initial assessment by the provider there, and you'll get a bunch of tests, labs, imaging, etc. And the first few hours is the bulk of the work that is done for that admission. So most of the plans that are done in those first 3 hours, because usually by then they'll know what you have, whether it's a pneumonia or a clot or what have you. And those plans are kind of set in motion for the rest of the hospital stay. Of course, this can change depending on your condition, but the bulk of that is at that time. A nurse would visit your room very often. Obviously, you're in the hospital, which means you're sick, so they have to kind of keep an eye on you. And this may be at any time of the day. Could be in the middle of the night, could be anytime. But as far as the highest yield in terms of plans made is what we call morning rounds. So that may happen usually anywhere between 6 to 8 o'clock in the morning. It varies by hospital. But this is where the doctor or other provider goes around and sees all the patients that he or she is responsible for. Most of the plans are made at that time, which means that if you have any questions, that's the time to ask them. Oftentimes, if you're at a bigger hospital, you'll have a whole team of people go into your room. You'll have the head doctor and then maybe some trainees alongside with the doctor, certainly nurses alongside because they have to listen to the plan and so forth. So you also may have physical therapists. You may have specialists of different specialties. Usually the head person who takes care and oversees the care is called hospitalist for most general medicine type problems. And then that hospitalist kind of directs, okay, you should be seeing a specialist, so I'll bring him or her in, and then the specialist sees you. And the hospitalist is the one who directs kind of the traffic as far as like okay, this is the problem you have, we'll bring these people in, or if the hospitalist can take care of things himself or herself, then that's that. But of course, at a hospital, there's a whole team of people, and I listed some there as well. And then discharging. So this is also a critical period because this is where you are told these are the medications that you will be on that are new or changed. So they'll give you a list of things to kind of have with you. And following those instructions is important. Follow-up appointments, again, very important, with either a specialist or with primary care. A lot of the things that are done with specialists obviously have to do with that specific problem in the hospital. With primary care, a lot of the times they kind of review the hospital stay. If something was changed, they review that with you. Oftentimes, there are tests that are done in the hospital that yield results that may not be relevant during that hospital stay, but may be relevant for your health later on. So that's where the primary care doctor or provider kind of oversees the documents and sees, oh, I noticed they picked up on, let's say a kidney stone that is not bothering you right now, but it may bother you in the future. And the hospital folks may not mention this because it was not relevant for that time. But if you've never known to have had kidney stones, you may want to know that because later on that kidney stone may pass and you will definitely notice that. So that's important. And then when you're discharged, they also tell you what symptoms to watch for. So that's important. And then here living at, several thousand feet above sea level, it is important to keep in mind that if you are discharged on oxygen, or initially need oxygen during the hospital stay, that if you're going to be moving to a higher altitude, then the hospital people may not know that, and your hospital needs may be different at that altitude in the hospital versus when you get home. I've seen this happen when people get like a pneumonia or something like that, and their oxygen level is kind of in the borderline during the hospital stay, and they don't need additional oxygen. But as soon as they get home, the oxygen goes down for a higher altitude, and then they do need oxygen. And that puts some people in a quandary because it may be the weekend and they may feel more short of breath. And sometimes they actually have to go back to the hospital just because of that. So keeping that in mind, and ideally, whoever's seeing you in the hospital should know that too, but that's not always possible. So pointing that out is good. All right. Well, that's the end for this week. Next week, we're going to talk about advanced directives and recognizing the limits of medicine. So thank you.